We do have a little bit of good news to share today. Hoag Memorial Hospital System in Southern California successfully divorced Providence. So it is possible. You can unwind these mergers given the will and the time. It was really heartening to see that not only they decided to get out, but they actually were successful. We should all send them notes of congratulations.
You know, our demographic here in Port Townsend we're pretty old here. And so I think they thought that it was all about reproductive health issues. They didn't realize that there are medical directives and there are death with dignity. Just bye-bye.
And my name is Bruce Cowan. It's great to see you all. I'm going to be like an MC or host to this meeting. We have a program coming up. This program will be recorded and it will be available in a few days on YouTube at Dennis Daneau's YouTube channel. So as usual, that's the approach we'll use. I think most people probably are fairly Zoom worthy here. So anyway, welcome to Indivisible Port Townsend. It's good to see everyone. I went to the National Indivisible site today and it said, the very first thing you see, it says, "We beat Trump, now let's save democracy." And that really is our mission. Our local leadership team has been talking about how to do that and this shift in our mission and how we can participate. So I want also to thank Linda Martin for arranging the program that we have today. She has been communicating with our guests for quite a long while in order to get this all lined up. And finally, the stars aligned and we are ready to rock and roll with this program.
Okay, well, thank you all for having us. And I'm going to turn things over, let Carolyn start us off.
Hi there. I'm so glad to be here to talk about this. And as you can see, the first slide, it says critical question. And I think this could be critical questions because there's really a lot of critical questions we need to ask our own primary care doctor and our other healthcare providers that we interact with. But this critical question is, did you know that at least 49% of all hospital beds in our state are now controlled by healthcare systems? They're faith-based, as we heard, and they limit legal and standard of care treatment to patients. You're lucky up there where you are, unfortunately, but down in Kitsap County, 100% of our acute hospital beds and other associated practices and services are limited. So, and you come down here to St. Michael's, which used to be Harrison, and Virginia Mason, that used to be secular and they no longer are. So you're seeing that impact as well. So, you know, this is a question that we all must grapple with and move forward and work towards accessing affordable, comprehensive, and equitable services that are becoming increasingly restricted.
Dennis, Carolyn talked a little bit about why she cares about this. Would you want to share why you care?
Well, you know, as somebody who has seen some of these services and had family members that have seen some of these services, it's a shock when you realize that there would be restrictions for things that weren't medically based. So I came out of a lot of work in reproductive justice. So that was where I started, but a growing awareness that there were many other services that were impacted by these restrictions as well.
And I care because I lived on Lopez Island during the time when Peace Health came in and took over the only hospital in the islands that was available to us. And island living, just by the fact of what it is, means that there's a lot of restrictions in terms of access to healthcare anyway. So to have them come in and then pretty much eliminate both reproductive services and end of life care that I was interested in was pretty devastating. When I moved to Bremerton, I was a Virginia Mason patient until just very recently, and that merger was the straw that broke the camel's back for me. And so I've been working in this area since that time. In fact, Carolyn and I co-founded Save Secular Healthcare in the late summer of 2020. We're dedicated to saving secular healthcare in Washington, and we began by fighting the merger between Virginia Mason and CHI Franciscan. We continue working to increase patient access to all healthcare services that are legal to provide in this state, whether they're offered by a faith-based healthcare system or by a secular healthcare system. It's really important to say right from the beginning that we do not have anything against any religious organization. We respect the right of every individual to practice the faith of their choice. But what we do object to is when religious doctrine that restricts access to safe and legal healthcare services comes along. That means that people no longer have access to comprehensive healthcare. Everyone should have access to a range of legal, high-quality healthcare services, and healthcare systems must prioritize patient needs over religious doctrine.
So I'm going to talk a little bit about the major players in Washington. Some of these names you've heard, some of them perhaps you haven't. Common Spirit is the largest nonprofit health system in the US with more than 1,000 care sites in 21 states. CHI Franciscan, is a name you've heard in the news, was formed in 1996 when Franciscan health systems joined Catholic Health Initiatives, and they're based in Englewood, Colorado. Catholic Health Initiatives is one of the largest nonprofit health systems in the United States and is now part of Common Spirit. So Common Spirit is the parent. Providence Health and Services is a nonprofit Catholic health system operating multiple hospitals across 8 states with headquarters in Renton. And Peace Health is a not-for-profit healthcare system that owns and operates 10 hospitals, numerous clinics, and laboratories in the Western United States. Currently, nationwide, about 17% of all hospital beds are in Catholic controlled facilities. And that facility, that figure is now, as you heard, roughly half in Washington, meaning that we have the dubious distinction of leading the nation in the number of Catholic controlled hospital beds, despite the fact that we have the fewest number of practicing Catholics in the nation.
Okay, so what are the ERDs? And that is how we refer to it, because saying the ethical and religious directives is a mouthful each time. But the ERDs do define what procedures will and will not be allowed in the Catholic healthcare system. These directives forbid or severely restrict many reproductive and end-of-life healthcare services, which we'll elaborate on in a few minutes. And like was mentioned when we first began, a lot of people are surprised that it's more than just abortion services. According to an analysis of the 2018 version of the ERDs, and I say 2018 because there's been many versions before and they do revise it periodically. The 2018 ERDs, which was written by, I can name their names, but it's not important, but it was a research document. Quote, the ERDs present a theological basis for the Catholic healthcare ministry and govern the way healthcare is delivered in Catholic health facilities and systems, including hospitals, clinics, and managed care organizations. And this is, and these rules are created by the United States Conference of Catholic Bishops, not medical experts, and it's based on Catholic religious beliefs. And we'll talk about the immoral and potentially scandalous procedures that they prohibit in their hospital system.
So what effects do the ERDs have on medical treatment in the CHI network and other Catholic networks as well? These directives are incorporated into hospital guidelines. It's the primary way the Catholic Church has instilled its doctrines throughout our state and national healthcare systems. The ERDs prohibit Catholic-owned and affiliated hospitals, that's important to note that it's also affiliated hospitals, from providing services that the Catholic Church deems either immoral or potentially scandalous. As a result, the Conference of Catholic Bishops, all men with no professional medical credentials or training, are able to create standards that actually dictate care.
So there's a misconception for those of you that have heard of the ERDs that they refer just to abortion, as Susan mentioned, or death with dignity. Perhaps you've heard that as well, particularly with the highly publicized case of the insurance commissioner recently and his twin brother. That's not the case. There are a variety of treatments that are restricted or banned. You see some of the items here. Contraception, even limited in cases of sexual assault. Sterilization, tubal ligations, and vasectomies. I myself received a vasectomy at Virginia Mason. I would not have been able to do that today. Abortion, any fetus that has a heartbeat, even to save the mother. And that includes miscarriages and ectopic pregnancies. Infertility treatment, something else that both my family and my daughter's family have taken advantage of. Artificial insemination and in vitro fertilization, considered immoral. Surrogacy, which affects both the heterosexual and gay couples. Hormone therapy, especially related to trans patients and transgender surgeries, gender affirming care, and end-of-life care, even the legal death with dignities. And a special note here, ERD number 61 references a particularly chilling value called redemptive suffering that we may return to here, which basically says that you're suffering to pay for all of our sins. These are the 6 parts of the current version of the ERDs. We're going to give a brief overview of the 5 parts that most directly impact patients, and they are social responsibility, professional patient relationship, reproductive services, end-of-life issues, and collaborative relationships with secular providers. Before we move on, do you have any questions about the ERDs in general?
Oh, could you explain what surrogacy means a little more in detail? I didn't really.
Surrogacy, it would be when you contract with somebody or make an arrangement with somebody to carry your child to term. Typically is a situation where a mother, prospective mother, carries the child of another.
Linda and Mike have a question.
Yes, I was inquiring about the contraception ban.
You're muted, Linda.
It's not Linda. There's somebody on a
phone. I wanted to know if that was
I know,
just...
Susan, I read in one of the newsletters, I think, a woman had gone to, I believe it was Virginia Mason, with a miscarriage in progress that was very dangerous for her. And I don't remember the details, but she was turned away and had to go and find another hospital, and she nearly died, as I believe. Can you clear that?
I heard of a similar news story. Maybe it was the one you're speaking of here that occurred in Bellingham with Peace Health, where the couple in question checked into the emergency room repeatedly with severe hemorrhaging and eventually drove to Seattle, which probably saved her life.
So we have a question on the telephone and then Marilyn Friedrichs.
Okay.
The telephone person got started but got cut off. So
sorry.
Was that me?
yes, 0275.
Okay. Yeah, I was inquiring as to the contraception ban. What type of contraception are we talking about here? Are we talking about just like Plan B, or are we talking about all contraception? Could that be clarified?
Yeah, and honestly, you caught me flat-footed to some extent. I know that it definitely applies to Plan B. It's unclear why a hospital system would be involved in other kinds of contraception. So you got us there.
Well, no, actually, Dennis, I do know that at St. Michael Hospital in Silverdale, the pharmacy at the hospital does not dispense any form of contraception at all.
Okay, yeah, that is true.
So a doctor would order, say, whatever injections or oral contraceptives, and they wouldn't be filled?
They
Right.
won't be filled by the pharmacy at the hospital.
So Marilyn, what's your question? You're muted.
Hello?
Marilyn, we can't hear you.
I'm done. Thank you.
Thank you.
Marilyn Friedrich?
I just unmuted. I have a question about the ERDs. If I were to check into St. Michael's in Silverdale, do they let me know about these ERDs when I'm admitted?
I don't believe that's ever happened, Susan.
No, they do not. They do have a Reader's Digest abridged version of the ERDs posted on their website that talks primarily about patients' relations with God and that sort of thing.
Patients related with what?
God.
Oh.
Relationships to God, because that comes first.
I'm in trouble already.
But no, you will not be offered a copy as part of informed consent. And if you ask questions about it, you'll have to actually have your own copy of it to know what questions to ask. It'll be like pulling teeth.
Yeah, we recently did another presentation on a different tech, and the question came up there as well. But it largely obfuscation is the tool they use here, where there's redirection. There's you'll hear in some of our examples, perhaps, that when challenged in even regulatory settings, they'll deny there's any restriction, but then miraculously no tubal ligations happen.
Okay, John Collins has a question.
Yeah.
Okay, maybe that should be our last question.
Yeah, I think so.
Now. Yeah.
Yeah. Do these apply equally to inpatient as well as outpatient services?
Yes, they do.
Okay, let's pick up the thread.
Okay, great. So we're going to move on to Carolyn talking a little bit about part 1, social responsibility.
Hey, yeah. So the ERDs, it's a quite a long document and very detailed, is divided up into parts. I think there's 8 parts, and part 1 is kind of an overview of their social responsibility. And I'm seeing something here, Susan. It's not there. It looks like there's some background over the top part of that first. Okay, thanks.
There we go.
Okay, so the overall social responsibility, as you can see here, is to contribute to good society and to the reign of God and be a transformative power in society. And so in the ERD documents, they do have they're bullet pointed, so to speak. So so specifically on social responsibility, number 8 and 9 emphasize reliance on canon law. Not being religious, I didn't know what canon law was, so I looked it up. And it says canon law is a set of ordinances and regulations made by ecclesiastical authority, being Catholic Church in this case, for the government of a Christian organization or church and its members. So anyway, we'll go to number 8, which is in part 1. And it says, quote, the relevant requirements of canon law will be observed with regard to the foundation of a new Catholic healthcare institution, the substantial revision of the mission of an institution, and the sale, sponsorship, transfer, or closure of an existing institution. So it's not just the main hospital. It's all affiliated hospitals and groups. And number 9, employees of a Catholic healthcare institution must respect and uphold the religious mission of the institution and adhere to these directives. And I believe that is supported by the contracts that they need to sign before they are allowed to work within the system.
So we're going to move to part 3 now, which talks about professional patient relationships. And as you can see on the slide, there is a statement that this relationship is never separated from the Catholic identity of the healthcare institution. And all of the ERDs in this particular section relate to these relationships, but there are 2 that are particularly cogent for us to point out to you this evening. The first one is number 24, which says, the institution will not honor an advance directive that is contrary to Catholic teaching. And number 28 says, the free and informed health care decision of the person or the person's surrogate is to be followed as long as it does not contradict Catholic principles.
That's
So
incredible. That's shocking.
People who think they have taken care of getting their advance directives all put into place discover after the fact, because again, remember, you're not told about these until you ask. And usually when you ask, it's too late. But people go in thinking that they've got everything figured out, and in fact, they don't.
So now maybe you understand why we've been working a lot to try and get full disclosure from hospice providers. So I'll talk about the part 4 of the ERDs, issues in the care and beginning of life. And I'll let you read this statement here, or I'll read this. The church cannot approve medical practices that undermine the biological, psychological, and moral bounds on which the strength of marriage and family depends. Reproductive technologies that substitute for the marriage act are not consistent with human dignity. So it's no accident that religious institutions refer to all procedures that result in termination of the human pregnancy as an abortion, even when the fetus is not viable and not ending the pregnancy could lead to serious or fatal consequences for the mother. This is a contentious term used to upset people. Specifically, so things that are not abortion but have this similar effect might include ERDs 38, 39, 40, and 41, which denies acts of assisted conception, such as in vitro fertilization and artificial insemination. Number 42, which denies surrogacy. Number 45, which denies termination of pregnancy at any time, including miscarriages, if there is still a fetal heartbeat. Number 48 denies any intervention for an ectopic pregnancy. And this, I certainly consider one of the cruelest.
So part 5 is the other end of the spectrum of our lifespan, which is issues for the seriously ill and dying. And I want to read this quote too, because these quotes are just chilling. Quote, we are not the owners of our lives and hence do not have absolute power over life. We have a duty to preserve our life and to use it for the glory of God. Once again, the choice of language is not accidental. Religious institutions refer to physician-assisted suicide, the term suicide, which has all kinds of red flags attached to it, while secular institutions use less charged language such as death with dignity. And so specifically, there's several of these ethical and religious directives, but specifically we'll talk about number 60 and 61. Number 60, quote, Catholic healthcare institutions may never condone or participate in euthanasia or assisted suicide in any way. So here again, they use the word euthanasia, which throws up red flags, of course, to everybody. Number 61, patients experiencing suffering that cannot be alleviated should be helped to appreciate the Christian understanding of redemptive suffering, which Dennis mentioned before. And I just want to define redemptive suffering. It is the Catholic belief that suffering and death can take on a positive meaning through the redemptive power of Jesus' suffering and death. This does not lessen the pain and fear for a terminal patient, but gives confidence, which allows the person to bear the suffering and pain and not be overwhelmed by it. I don't know about you, but when I'm dying and I'm in serious pain and there's not enough medication to prevent that pain, I really don't want to buy into the redemptive suffering idea.
And then the final part of the ERDs is part 6. And it addresses the collaborative arrangements that Catholic institutions can enter into with other healthcare providers and organizations. And this is where there have been a lot of issues, not only currently, but also in the past. There was a time, you may remember that I think Carolyn mentioned that we are dealing with the 2018 version of the ethical and religious directives. There have been multiple versions prior to this latest iteration. And over the years, there has been a certain amount of flexibility that was allowed. For example, when Hoag Memorial went into its original agreement with St. Joseph's back in the day, at that point in time, the ERDs that were in existence allowed for Kamala Harris, who was the AG in California at the time, to work with both entities to ensure that while St. Joseph could go ahead and express its Catholicism in treatment, that Hoag would be allowed to continue to function as a Presbyterian hospital, which is what it had been. That worked fine until the 2018 directives came along, when all of the loopholes were closed. And that's when Providence, which bought out St. Joseph's, when Providence then started walking back all of the agreements that had been made. And that's when the doctors at Hoag said, whoa, wait a minute, time out. We never signed up for this. So what this section does is, in a number of different directives, it says what may and may not happen and what kinds of arrangements can be made. And they all fall to the side of supporting the ethical and religious directives. So very quickly, I'll highlight 3 of them. In Directive 70, it says that Catholic healthcare organizations are not permitted to engage in abortion, euthanasia, assisted suicide, and direct sterilization. 73 says that a Catholic institution must ensure that neither its administrators nor its employees will manage, carry out, assist in carrying out, make its facilities available for, or benefit from revenue generated by immoral procedures. You may remember SB, I can't remember the number now. A bill that passed last session. Emily Randall was the sponsor. It was the Protect the Pregnant Patient Care Act. And the whole purpose for that act was to say that doctors who worked for faith-based organizations that prohibited abortion could not be fired or punished in another way if, in fact, on their own time at another facility, they performed an abortion. That was a way to try to undo some of this. I think it was 5042 was the number.
5140, Susan.
5140, thank you. And then 74 says that in any kind of collaboration, whatever comes under the care of the Catholic institution, under the control of the Catholic institution, whether it's acquired, governed, or managed, must be operated in full accord with the moral teaching of the Catholic Church, including its directives. That becomes really critical with the St. Michael's situation, because initially when Virginia Mason and CHI Franciscan merged, they had co-CEOs. Conveniently, within a year of the approval of this merger, Gary Kaplan, who had been CEO of Virginia Mason, stepped aside and turned full control over to an employee of CHI Franciscan. So any promises that were made about how Virginia Mason was going to remain a secular institution, it was not going to become a Catholic institution, it does not matter, because Directive 74 takes care of that.
So this came up a little bit earlier here, but how are the ERDs enforced? Well, in a lot of cases, it's a dearth of information that's provided. So enforcement only really comes up if people actually know their rights or advocate for their own care in such a way that it crosses with these unseen contracts. So some of the things you see here, the local bishops preside over the interpretation of the ERDs, and they make the ultimate decisions regarding contested medical cases. In hospitals, and in particular the Peace Health situation in Bellingham that we heard about, the hospital was convening a panel to decide what to do with this individual who was hemorrhaging. Probably would have delayed their care to a point where it would have been unsafe. Providers who are employees of the healthcare system who are on contract to perform services with the system are required to sign contracts that include clauses in which they agree to abide by the ERDs as a condition of employment. Now, when you think of hospital beds, hospital systems, of course, also include all of those outlying services, outpatient services, and certainly almost any kind of practice also requires admitting privileges. So that's where the control can be administered. Providers in either of these situations are fined or fired if they violate the ERDs. And there may be situations where independent providers refer patients to facilities owned or operated by the healthcare systems. In those cases, the ERDs are normally enforced.
What kind of impact do the ERDs have? Well, I think probably after hearing what we talked about already, in your head, you're thinking about how this is going to impact you. But there's probably things that you don't know about. We certainly know it reduces the quality of our healthcare. But the other things is it really disproportionately impacts certain groups, and it increases cost to patients. For one thing, it makes dangerous and unnecessary delays, and it may mean patients are unable to receive the care they need when they need it. And we just talked about that in great detail. For example, when a patient who needs a miscarriage management may be referred to an ethics board for a decision as to whether or not the necessary procedure can be completed instead of being provided immediate care. And Dennis just talked about that very concisely. And they may be referred to a provider outside of the network. And that will impact, of course, if you happen to have to go to a provider outside of your insurance network, that may certainly impact you financially because your costs might not be covered. And it disproportionately harms women, terminally ill patients, as we saw with death with dignity denial, BIPOC or Black, Indigenous, people of color, LGBTQ individuals, low income, and rural populations. So the results it results in reproductive injustice to individuals and communities. And the Catholic healthcare systems in Washington are among the most expensive in the state. And there have been lawsuits over that. And there's also some bills going through our session in Olympia currently to impact that in a positive way and have some rules over that. But anyway, additionally, when patients are forced to seek care outside the system, as I said, the insurance may refuse to cover it or reduce coverage significantly. And then additionally, patients may be liable for travel costs to get to providers who will treat them. And that, of course, impacts people who don't have as much ability to travel as some of us more privileged people do. So I will then turn this over to Susan.
Okay, so there are actually things that can be done. And we're going to wrap up our talk by talking a little bit about some of the remedies. So we'll be looking at how you advocate for state and national legislation, how you can advocate for yourself as patients, and also then just refusing to accept this situation as being irreparable.
So here's a list of some things in the current session that we're supporting here. I actually have a bill number for that first item, the advanced practice 57, Senate Bill 5766, which would expand the practice of abortion providing to include nurse practitioners and physician assistants. So the Keep Our Care Act, last item on the Senate Bill Act, is a act intended to help put a review process on mergers of the sort that occurred with CHI and Virginia Mason. So the Keep Our Care Act is one of the primary bills that we believe you might support. And then some other bills that address penalties for unsupported prescription drug price increases, establishing dental therapists on the House, access to death with dignity. This was a bill that went nowhere last year. We're hoping it will this year. It would reduce the waiting period and expand the access for people who do elect death with dignity provisions in the state. Coverage for hearing instruments for children and adolescents, providing behavioral health system responses to individuals with substance use disorder. And there will be additional bills as the session progresses. Susan will show you where to find more information about these bills. At the national level, Biden's healthcare platform does include regulation of mega healthcare systems across the country and the appointment of an advocate in the form of Lena Khan as chair of the Federal Trade Commission. Those are positive signs that there is interest in addressing this situation federally as well. Susan?
So
actually, Carolyn.
Yes. So how do you advocate for yourself as a patient? Well, basically, it's kind of the who, what, where, when, and how approach to asking questions. And it probably starts with your primary care doctor, because you want to know who owns, where your primary care physician is working and what services they provide, and that sort of thing. So, I mean, all too often, people make assumptions about the care they will receive and discover too late that their assumptions were wrong. These are questions up here on the screen. You need to ask so you are fully aware of who is providing your health care and what you can expect in terms of access to treatment. But I also want to add that you can ask your primary care doctor questions, and they may, in all sincerity, tell you something that is not true. So you need to do other research. My example is I was with Virginia Mason in Bainbridge Island since 1983. I have had 2 primary care doctors. And when the CHI was eventually able to take over the hospital, I talked to my primary care doctor. And as Susan said, my primary care doctor assured me up and down that since Gary Kaplan was going to be head of the hospitals, that we were going to have access to everything we had accessed previously, which Susan has said, of course, is not true. I actually took her a copy of the ERDs and handed them to her before I did my exit interview with her, telling her why. And she still sincerely told me that she would be able to do these things. And also, if I wanted end of life care, I could go, death with dignity, I could go to End of Life or another organization without telling me that she wouldn't be able to help me. So you need to really advocate for yourself, and you need to talk to your friends and family about advocating for yourself.
I just put into chat 3 links. One is our email address, one is to our weekly newsletter, and the other is to this live binder, which I'm going to show you now. This is a digital 3-ring notebook, and we have developed this so that we can have information that we think people would be interested in learning about at their fingertips. The metaphor is 3-ring binder. The tabs up here are the equivalent of dividers, and you can click on any of them, and when you do, you will then see a series of what's called subtabs, and these are the equivalent of sheets of paper in the notebook. So I clicked on the tab that is for the 2022 session, bills that are related to healthcare. There's in orange some introductory information that you can click on. The blue tabs represent Senate bills that we are supporting, and it includes information. I'll just click on the Keep Our Care Act. You can come to any of these pages. You get a link to the bill, an explanation of the current status. And if it's a bill that was introduced in 2021, you'll also get previous history. So you can come here, but also if you are interested in learning more about the ethical and religious directives, if you click on that tab, there is a copy of the 2018 directives that you can download and read. There's also a comparison between what the previous iteration of the ERDs was and what we've got now. And also the study that Carolyn referenced is here, the ethical and religious directives, what the 2018 update means for Catholic hospital mergers. So there's a ton of other information here. You are more than welcome to access this binder anytime you'd like. Share the link with other people who you think might be interested. It's important stuff, and folks need to be aware of as much of this information as we can get out to them.
Yeah, as we've said here, this is not unsolvable here, but it will require actually some action. I'm going to put a few more links here. These are some things that you can do. We have a newsletter, as Susan mentioned. You can email us for additional information, and of course, here's another link to the live binder as well. We all need to fight for this. We know what will happen if we do nothing. That's kind of what happened with Virginia Mason, in spite of what appeared to be some very compelling reasons that merger should never happen. So we're working to educate the public about the impact of these healthcare system mergers on our access to care, and how to work with legislators to enact laws that will protect us, and how to help you know how to advocate for yourselves.
So actually that wraps up our presentation. So I will stop sharing and hand it off.
Thank you. And what an outstanding presentation. And I think we can all appreciate the gravity of this. I have fielded many questions along the way that were sent just to me. And I can think of some things that really might kind of clear the air, you know, with some of these questions. For starters, Jefferson Healthcare is a public hospital that we own. We have commissioners. There wasn't at one point we went to Providence's record keeping system. I think we're still part of that. And it sounds like some of the conditions that might come with that have changed. We were able to keep the ERDs out because we had 2 very astute commissioners who are no longer on the commission who spotted that and said that's a deal breaker. So I don't know what the situation is there. I don't know if anybody here does, but I'm going to suggest to Case Kulf that I'm going to ask him that question. He's a commissioner and a former and a doctor, and maybe he can get back to us on that. Okay. The next thing is that, we hear, of course, we think about ourselves. How, so let's say that I don't want to go to a Catholic hospital, and I know that now, and I want to maybe in plan for that, maybe with my wife or whatever, that if I have a stroke, I don't want to end up at St. Michael's. Because I won't be able to, voluntarily end my life there in any way. So that's a question that I have. Is there some way that you can know which hospitals, and well, shouldn't be too hard, but to make a plan so that if you go to the ER here and you're having a stroke, you don't get sent to a Catholic hospital?
Funny you should mention that, Bruce. We are actually in the process of pulling together an exploratory team in Kitsap County where we would form partnerships for primary and urgent care hosted by secular systems. And part of that would be arranging for patient transport agreements. The reason that you get sent to St. Michael or someplace else isn't necessarily because it's the closest hospital. It's based on whatever the EMTs, what the agreements they have entered into. And so we're going to be exploring the possibility of making it a reality that patients who know they don't want to go to St. Michael or another Providence or whatever hospital can say when they go into one of these clinics, I would prefer to be transported to Tacoma, to Seattle. I understand that that might have an impact on my outcome, but I would rather do that. And so we are working on that, but it has to do with transportation agreements. You might want to check with your public hospital or with the EMTs who have these agreements, because there is flight insurance. When I lived on Lopez, we had helicopter insurance.
We have that here.
Okay, great. So with helicopter insurance, go with the UW and maybe you'll be sure that you get to go to the UW.
Yeah, I'd like to point out that this, once again, is a disparity between people who can afford that and who cannot. So that's maybe an answer for us, some of us, but once again, it certainly eliminates a large part of the population to have that option.
Yep.
It certainly does. So another question that comes up here is we have an outstanding progressive insurance commissioner and have had for a long time. Mike Kreidel he's just been fantastic. How involved in this is he, and is he helping with legislation? Also, I wonder about the AG, Bob Ferguson.
Mr. Kreidler is actively supporting HB 1140. Oh, okay, I can't do numbers tonight.
1141, Susan.
1141. Thank you, Carolyn. You be my number person, please.
I will. Yeah.
He is actively supporting 1141 because of what happened with his twin. And he has become very interested in all of the impact of the ethical and religious directives. We are working with one of his legislative folks now, and yes, he really is concerned.
And the AG's office was also involved in some of our discussions, but because there was no, and the Federal Trade Commission, which Susan, you can comment on too. But they were limited in the scope of which they could apply. That's one of the reasons why the Keep Our Care Act is so important.
But the good news is that, as Dennis mentioned, the appointment of Ms. Khan as the chair of the Federal Trade Commission is a really positive step forward. Her background is antitrust. And they are looking not only at horizontal monopolies, which we're all familiar with, but also what's called vertical monopolies. Now, healthcare systems call it vertical integration, but in fact, it's monopolies. For example, I don't know what the statistics are in Clallam County, but I do know that in Kitsap County, not only does CHI Franciscan operate 100% of the hospital beds, but they also are in charge of 69% of the hospice services provided in the county. So if you're in the hospital and you get referred to hospice, they refer their patients to their own hospice program. So that's the vertical monopoly. And so that's something that's now being looked at too by the federal government. And when that's done, then Ferguson can step in and do more.
I see that Marilyn Friedrich has her hand up. I think Linda and Mike, your hand is up from before. I'm not sure. Marilyn, would you like to ask something? Here you are.
The live binder, does it tell us which hospitals we should specify?
It does not, but if you send us an email, we can send you a list of secular hospitals. But basically, any UW hospital, any multi-care hospital are secular, and any public hospital.
Give a couple of examples.
Okay, so Harborview, Tacoma General, your public hospital would be 3.
Yeah.
If there's Saint something in the name, don't go.
A simple rule to follow. Gina.
Yes, because I was exploring the possibility of having hip surgery through Jefferson General a couple of years back, and they would not allow me to get it done there because I have a cardiac issue. And so therefore, while I like the orthopedic down at West Sound and stuff, the orthopedic doctor there, but I really didn't have a choice that I had to go there because Jefferson General didn't want to deal with me in a hospital where they didn't have advanced cardiac care. So, it gets very complicated. I don't know how to handle that because I'm looking at another orthopedic operation, and now I wonder what to do.
Is the UW not an option for you?
Well, the doctor who I like very much, and I also live alone, so I don't have transportation options or backup plans or anything like that. So I want to go to the nearest place possible, and that happens to be St. Michael's, which I like in other respects. But if something were to go wrong and I were needed cardiac care or something, it would need end of life directives to be applied. I would be stuck, I guess.
Yeah, you would. If you can't arrange to get to Tacoma or to the UW, and that's why we are wanting to be able to arrange for patient transportation, but also to inform people so people can start pushing back and say, I'm sorry, this is unacceptable.
Well, I think the cardiac doctors at Jefferson General, as far as I know, they do all their work down at St. Michael's because of what I've needed to have done. I had to go down to St. Michael's, even though I meet the doctors here on their appointment day every so often.
Yep. Well, and they did that on purpose. Okay, when they went into the merger originally with Harrison Medical Center back in the day, they promised to leave the hospital in Bremerton. They moved it to Silverdale on purpose because they wanted to court patients from Port Townsend.
And they got us. Let's move on to, I see that Linda has her hand up for real.
I just wanted to add about hospital availability. If you are military, retired military or whatever, the VA hospital is secular, of course, and has excellent medicine. And they coordinate with the UW medical facility. So just an additional option.
Linda.
Okay, I had put a question in chat You haven't mentioned Swedish, but
they're owned by Providence.
they're owned by Providence. So
Yes, they are. And they paid, Providence paid a boatload of money to keep the Swedish name.
okay, now, but they have a separate cancer facility. Is that also
All Providence.
all Providence?
But SCCA has a wonderful cancer facility in Paulsbo.
What about Cancer Care Alliance? A lot of folks go there.
That SCCA is Seattle Cancer Care Alliance, and
Okay.
they've got a clinic in Paulsbo, and they're wonderful.
Yeah.
So the Cancer Care Alliance is not a Catholic.
It's UW.
It's UW.
It's UW. Okay.
Good deal. Frank Layden.
Hi, I'm not Frank. I'm his wife. Will that do?
Sure. Who are you?
Bruce. I understand that the League of Women Voters in Kitsap County is sponsoring this question as one of their topics of the year. I'm wondering if our local league can do the same to broadcast more widely.
I can speak as a member of the local league that we don't do studies. We are a unit at large, not a chartered league. So we're not really chartered to do that kind of thing. But we can certainly look at what the state league does and make anything public that they come up with.
What kind of staff pushback was there at a lot of these hospitals? I mean, you mentioned a couple of situations where doctors were aghast at what happened, but what was the general reaction? Did people quit? Did they just succumb?
A lot of them just kind of rolled over. There are a lot of people in Kitsap County who work in healthcare in Seattle who had thought they might come and try working in Kitsap County, but after the merger, they've either retired or they have opted to stay in Seattle. There have been huge employee issues with St. Michael. St. Michael had the largest hospital outbreak of COVID, at least initially. I don't know if one has ever gotten bigger than that. They were not giving PPE to their employees. They were not enforcing protocols. And the Department of Health and another group came in, and the hospital ended up getting fined. And then there was recently a lawsuit where nurses and other healthcare workers were being forced basically to work through their lunch hours, their breaks, before their shifts, after their shifts. And that suit was successful. And St. Michael was fined and told they had to stop doing that.
I think in two situations, the Swedish merger in 2014 resulted in what amounted to mass insurrection by the OBGYN folks. And they established a compromise which included funding some local chapters of Planned Parenthood clinics, funding that just expired this year. That was, and you can see the effect on the ERDs with that revision to the 2018 or 2016 changes, I believe it was, because it was laser focus on closing those loopholes.
Mm-hmm.
Yep. Another example is Yakima General, which elected prior to the Virginia Mason merger to disassociate with Virginia Mason because its doctors were essentially rebelling at the possible changes.
Let's go to John Collins. And if you've had your question answered, would you take your hand down, please? It's a command at the bottom under reactions.
Thank you, Bruce. Transport is a critical factor here. You just mentioned our East Jefferson Fire and Rescue does take patients to hospitals. In fact, they took me to Virginia Mason 2 years ago, and I didn't really have any choice as to where they were depositing me. Is that, do they have what agreement that they have to take them to certain hospitals?
They have, it's actually the EMTs who end up making the final decision. But it's based on agreements that they have made with various hospitals. And so if a transport agreement is put into place that says patients who request not to be taken to certain hospitals can be taken to this hospital or that hospital as an alternative. So you can put anything you want in a transport agreement. You just have to know that you need, when you're negotiating these agreements, to do that. And nobody ever thought about it before. It was like, go to the closest hospital because that would be best.
Susan, are these the EMTs that work for fire districts?
Sometimes it's whoever provide. It might be a private ambulance company.
We have fire districts out here. All our EMTs are public.
Okay.
So we can work through our fire commissioners, who we elect, and let them know that we need these alternatives.
Yep.
And I think we have some good people there, at least in District 1, I know.
And this is this is something that's been done in the islands for years. Everybody has to be flown somewhere if you're on one of the islands. It's also happening in the eastern part of the country, in rural areas where they no longer have hospitals, just urgent care and primary care. Same kind of thing is happening. Anybody who needs to be hospitalized ends up getting transported somewhere.
Other questions? I see Pat Teal has a question, and followed by Nancy Field.
I just wanted to reiterate, it blows me away. An ectopic pregnancy without intervention, in case people don't know, is a death sentence. So they will let a woman die rather than intervene in an ectopic pregnancy. That's how bad it is.
Yep.
I think that the woman, that Aaliyah on the phone had a question. I don't know if she's still on the call. Yeah, there's a, I think she has.
We'll go to Nancy Field and then to Aaliyah.
Okay.
Nancy?
Thanks, Bruce. I want to thank Dennis, Susan, and Carolyn. I've worked with them off and on over the last year, and they're an incredible team. I'm a retired hospital administrator. I wanted to mention a resource that's very obscure, but very helpful to answer some of these questions. The Department of Health has a rule that every hospital must file its policies with the Department of Health for posting so the public can access it. And in the chat at 6:07 p.m., I put the link. It's buried 4 or 5 layers below Department of Health. You'd never find it if you didn't know where to look, but I've provided that link, and you can look at every single hospital in the state. And there's a category called end of life, and there's a category called reproductive health services. Now, be forewarned that these policies frequently are so vague, they're not telling you anything, but you can at least see what your hospitals have said. And it's important to know that most of the public hospital districts and all the secular hospitals in the state also do not cooperate with Death with Dignity. The last time the state published that list, there was only one hospital in the state that would help you with Death with Dignity. That was Whidbey General, and that was a number of years ago. That list isn't available anymore. And as to reproductive health, those policies are probably a little more helpful. But that link will give you a way of looking at every hospital that you might be thinking about going to. But it's really important to realize that a large number of the non-religious hospitals in the state have the same attitudes from their board members, whether elected or not. So it's not just the religious hospitals that are refusing care.
Thank you, Nancy. We'll go to Aaliyah and then to Leslie Aiken.
So for us locally, 2 important issues are the reproductive care and death with dignity. Myself and my neighbors have worked on that for a long time, and we were so happy when those services began being provided a few years ago by Jefferson Healthcare. So how can we quickly get information on what is happening with Jefferson Healthcare? Have they reneged on this? Are they being pushed back? When they did the merger a number of years ago, I was very concerned that these issues would be on the chopping block. And how can we get really clear information right now about the status?
Whatever I find out, I will try to write up for the newsletter of this this organization.
Great. And your name is?
This is Bruce Cowan.
Yeah. Hi, Bruce. Thank you.
Yeah. Go ahead, Leslie.
I have just a quick question. I'm needing to know a little bit more about this helicopter insurance, which is news to me. Does Medicare cover that kind of service? Or do I need to pay for it? And does anybody have any information about it?
There are two services and you pay for it. Does that about sum it up?
Well, but the
Medicare
cost
cover it?
is not as much as you might think. It's something like $80 a year for an entire family. So, and if you can afford it, it's well worth it.
And
So I just go to Chris Manwaring and ask for helicopter insurance and she'll find a policy for me, I guess.
It is two organizations. One's called Airlift, and what's the other one? And there's some kind of, and it's complicated about how they about having two. I think we went with both, but we're privileged. So that's how we handled it. So sort of side topic, but important.
Medicare does
And-
cover transport.
By helicopter?
Yes.
Okay.
But my question is that only if they take you to where they want to take you? If you decide to go somewhere further, for instance, Tacoma, because you don't want to go to a religious.
Right, that's why getting the transport agreements in place is so important.
Okay, I get that now. Thank you so much.
Yeah, and there was a question about Kaiser. Unfortunately, Kaiser in Washington is steering away from having very many of its own hospitals. So the reality is, if you're in Kitsap County, for example, and you have Kaiser, you will be taken to St. Michael.
Okay, Susan, any last words for us?
Thank you all so much. It's really been wonderful to get a chance to talk with all of you. I hope that this is really helpful. Please reach out to us. We would love to interact with you more. I don't know, Carolyn, Dennis, you want to say anything?
Yeah, I would like to say something about death with dignity and access to it, because I don't think it's been mentioned that most hospice care does not occur in hospitals. It occurs in your home. And so it's important to find a hospice care group that will come to your home that are secular. And I think Dennis really knows more about this than I do, but because he's involved with end of life. And so there, maybe Dennis could, and it's been wonderful talking to your group. I hope we've given you some information that you can use, and certainly contact us if we can help you.
Yeah, I'd like to make the same statement here. It's great seeing you all. I hope this was helpful, if alarming.
Very alarming.
Both.
I thought I knew, but I knew just that much.
And my only admonition here is, please tell other people. It's astonishing still when I talk to people and they have no idea about this stuff.
And when you say reach out, do you mean reach out to Indivisible Port Townsend?
I'm talking about your neighbors, your family members, everybody.
But I mean, to get more information.
And you can also email us if you want specific.
And us is Indivisible Port Townsend.
Save Secular Healthcare Washington.
There's in the chat, there's an email address or a place where you can sign up for their weekly newsletter on these issues. And that is the place to go. Indivisible Port Townsend is not going to be right in there with it. I think that our healthcare group will continue to pay attention to it. But it's not going to be like, we're trying to save democracy too. So That's really important work. And this is why we need democracy, is so we can work on issues like this. This has been an outstanding presentation, and I'd like to thank you. And if you would like to let people know, I'm sure your newsletter lets people know how they can get involved with you.
Yes.
And if you build your organization and need any funding or whatever, just reach out and we can spread the word.